At some point during an MCI, patients will likely be transported by EMS to hospitals. During these chaotic events, Incident Command will likely assign a patient transport officer to organize the EMS transporting crews and assign destinations for each patient. In addition, this person will be tasked with tracking each patient, as well as where they were transported. To facilitate and expedite this process, the MCI Transport Notice was developed. This allows for quick and effective notification of a patient transport from the scene of an MCI to a hospital while tracking all of the information. During an MCI, the transport officer or their designee will complete an eBridge MCI Transport Notice for each patient being transported off scene to the hospital. This step relieves the EMS crew from contacting the hospital and allows them to focus on patient care during transport. This function also keeps track of all MCI transport notices so that a transport log can be produced at the conclusion of the incident. Here's how it works. First, click on the transport notice icon. Then, fill out the form. You'll notice that the form requires you to input all areas highlighted in red and are self-explanatory. Start by selecting your EMS unit number, which is customized to your EMS agency. Then input the patient age and gender. Although not mandatory, it's valuable to enter the patient's information, if available, to expedite the registration process at the hospital. Then, select the patient triage classification as red, yellow, or green. This is the only other mandatory field. Next, you can input the patient injuries, the transporting agency, and the destination, if able. Finally, you can add additional notes if needed. Whatever you input, keep it simple. Prior to sending, review the summary. Once you're ready, hit send. That's it. EMS does not have to contact the hospital once the transport officer completes the eBridge MCI Transport Notice. From there, EMS can focus on treating and transporting the patient to their assigned destination hospitals.